Hidden signs you may have vitamin B12 deficiency. Hello and welcome to the channel. I would say that in general, people tend to undermine the effects or benefits of vitamins and minerals. When I talk to my patients about diet or a food regime, it is often in the context of weight loss, which is fine. I'm not knocking that at all. We rarely have time to get to the importance of vitamins before our time is up. But I'm here to tell you today that vitamins are crucial to overall health, and none more crucial than the B group vitamins. And here we can include vitamin B1, otherwise known as thiamine, vitamin B2 or riboflavin, vitamin B6 or pyridoxine, vitamin B9, and vitamin B12, otherwise known as cobalamin. Now, the B vitamins are particularly important, especially in the context of alcohol abuse. It is often the case that in alcoholic patients that they are substituted with particularly vitamin B1, thiamine, because alcohol abuse, alcohol excess tends to deplete vitamin B1. Just some general knowledge for you. Vitamin B6 is important in the context of tuberculosis treatment. Some of the medications we use to treat tuberculosis deplete vitamin B6 especially. And so we need to monitor that and make sure that the patient doesn't end up with a serious side effect due to the medication of the tuberculosis treatment. So, getting back on track. Vitamin B12 or cobalamin is an essential nutrient that plays a crucial role in maintaining nerve function, producing red blood cells, and supporting DNA synthesis or production. Despite its importance, B12 deficiency is surprisingly common and often goes unnoticed. I have a case that demonstrates exactly this. Stay tuned. The symptoms can be subtle and mistaken for other conditions, making it essential to recognize the hidden signs before they escalate into something serious. One of the most common yet overlooked symptoms of vitamin B12 deficiency is chronic fatigue. Even after a full night's sleep, the patient may feel exhausted, sluggish, or unable to concentrate. This occurs because B12 plays a crucial role in red blood cell production, and without it, oxygen transport to the tissues and cells of the body is compromised, leading to persistent tiredness. Another hidden sign is brain fog or cognitive difficulties. People with low B12 levels often experience forgetfulness, trouble focusing, and confusion. In severe cases, long-term deficiency can increase the risk of neurodegenerative diseases like dementia. If you frequently misplace items, struggle with word recall, or find it difficult to stay mentally sharp, B12 deficiency could be one of the underlying causes. I remember when I used to be a hospital doctor, especially when I was on call at night, we always had to cover the geriatric wards, the wards where the older people are. And it was almost a guarantee every single time I was on call at night to be called to assist the nurses in managing, shall we say, keeping under control an elderly patient who had become very confused. Now, the causes of acute confusion, especially at night, In a patient who during the day is normal and has no problems, include obviously dementia. Even a patient with dementia can appear normal during the day and suddenly at night go completely out of control in terms of their cognitive function. There is something about nighttime that takes away people's comfort zone in terms of their familiarity. You don't see very clearly at night. If you're older anyway, you obviously may not also see your loved ones. Your family may not be there in the hospital with you at night. You don't recognize anyone. So everyone is basically a stranger. And you feel threatened, you feel frightened, you feel confused, you feel unsafe. And often just the absence of daylight can cause confusion and sometimes aggressiveness. Now, the medical causes of this include B12 deficiency. Another cause is a simple urine infection. In these kinds of cases, it's always useful just to exclude that, because once you treat the urine infection, they're right as day again. No pun intended, by the way. Another cause to never forget is thyroid function. And so if it's not possible in the middle of the night to check it, at least we do that the very next day. So important is vitamin B12. It plays a crucial role in memory. Deficiency causes memory loss because of nerve function problems, and also confusion in terms of, again, cognitive function, not being able to function because of difficulties in sensory inputs, particularly vision. We've already talked a little bit to some extent on nerve-related complications of B12 deficiency, but in particular you have tingling and numbness, which are very common indicators of vitamin B12 deficiency. And this is because B12 is essential for maintaining the myelin sheath, the outer protective cover of nerves. Without enough B12, nerves become damaged, leading to the sensation of pins and needles in the hands and feet or other extremities. And very typically, it happens in what we call a glove and stocking distribution. So it's from the toes or the ends of the fingers and toes towards the ankle region in terms of the feet, or the wrist area in terms of the hands. So it seems to go upwards from the ends of the fingers and toes. Over time, this can progress to balance and coordination issues, increasing the risk of falls and injuries. Mood swings and mental health disturbances can also signal a deficiency. Low levels of B12 have been linked to depression, anxiety, and irritability. This is because B12 is necessary for the production of neurotransmitters like serotonin, which controls how depressed you may feel, and dopamine, which is obviously the reward center in the brain. There's a lot of information about dopamine, particularly with respect to social media these days. And of course, dopamine also regulates mood. A deficiency of B12 can leave individuals feeling emotionally unstable or experiencing mood swings that seem disproportionate to their circumstances. Another surprising sign of B12 deficiency is pale skin. B12 is involved in red blood cell formation, and when levels are insufficient, red blood cells become fragile and break down easily, leading to a lack of healthy red blood cells. This results in anemia, which can cause pale skin, and in severe cases, even jaundice, a yellowish tint to the skin and eyes due to excess bilirubin, a breakdown product of blood metabolism. Gastrointestinal issues, including loss of appetite, nausea, and weight loss, can also point to a deficiency. In some cases, individuals with a low B12 level develop glossitis, which is an inflammation of the tongue that causes it to become swollen, red, and painful. This can make eating uncomfortable and further contribute to a reduced appetite. People who follow a vegetarian or vegan diet are at higher risk of B12 deficiency because the vitamin is naturally found in animal products such as meat, fish, dairy, and eggs. Additionally, people with gastrointestinal conditions like Crohn's disease, which is an inflammatory bowel condition, celiac disease, a gluten intolerance problem, or those who've undergone gastric bypass surgery for whatever reason, either for cancer or maybe even as a weight loss surgery, may have trouble absorbing B12 properly. To prevent or address a deficiency, it's essential to consume B12-rich foods or take supplements as needed. Fortified cereals, dairy products, eggs, and meat are excellent dietary sources of vitamin B12. For those who cannot absorb B12 efficiently through diet alone, supplementation or B12 injections may be necessary under medical supervision. Recognizing these hidden signs early can prevent serious health complications. If you experience persistent fatigue, cognitive difficulties, so brain function problems, nerve-related symptoms, or mood disturbances, it may be time to check your B12 levels. Consulting your healthcare provider and making dietary adjustments can help ensure your body receives the nutrients it needs to function properly. I had an interesting case of vitamin B12 deficiency a few months ago. A man in his 60s came to me complaining of tiredness. Now, that in itself is a red flag. It is actually unusual for men to come to the GP in the first place, even when pushed to do so by a loved one. Particularly men in this age group, 50s to 60s. And when they do come in, it is not typical for them to come complaining of tiredness. A euphemism is often used instead, at least in my experience. Something about not sleeping well, lacking motivation, feeling down, under the weather, and so on. This chap just declared plain and simple fatigue. No prompting or cajoling on my part. You see, this made me sit up. It is women who tend to be more forthcoming with symptoms of tiredness. So when a man complains of tiredness, to me, it piques my interest. Further questioning revealed that it had gone on for literally years. He had just learned to live with it. He also volunteered the information that his fingers and toes were sometimes numb. This really made me sit up. My first thought was, does he have diabetes? As you know, I hope, diabetes can cause problems with numbness and tingling in fingers and toes if the patient already has the complication of diabetic peripheral neuropathy. Diabetes makes you tired. So I thought, maybe we should exclude diabetes in the first instance. The patient had not had a blood test for years, so we started with that, a simple blood test. He wasn't diabetic. But I noticed something else. His blood picture, what we call full blood count, or if you are in America, whole blood count, I think it's called. If you're in Europe, hematogram. Basically, this is a general picture of the blood, where we look at all the blood cells, the red blood cells, the white blood cells, the platelets. And I noticed that the size of his red blood cells was massive. There are only a few causes of this, what we call megalocytemia. Or if there's an anemia associated with it, megaloblastic anemia. One important cause is thyroid disease, particularly an underactive thyroid. But he didn't have a thyroid problem. Alcohol abuse is also a factor that causes this picture. But our patient wasn't a huge drinker, just normal quantities of alcohol, a glass of wine on a weekend evening, nothing more than that. So the next logical step for me was to check the vitamin B12 levels. That is perhaps even the most common, so the primary cause of a megaloblastic picture, huge red blood cells. The results surprised me. In fact, his B12 level was so low that I thought it must be a technical mistake. I rang the lab to check if the result was believable, if it was credible. They assured me it was, but I asked them to run it again. They did. The same result came back. I still didn't believe it. I asked them to run it again. They did. Same result. This time I had to really believe it. He basically had such a severe deficiency of vitamin B12. Now, strangely enough, so had his daughter in the past, whom I had treated. And finally, I was able to put 2 and 2 together. Now, vitamin B12 deficiency can sometimes be nutritional. In fact, most of the time it is nutritional. And indeed, we do frequently find it in vegetarians and vegans. But there is another cause. Yes, you may have guessed it, autoimmune. Vitamin B12 deficiency is associated, thankfully not always, with a condition called autoimmune atrophic gastritis. Now, autoimmune atrophic gastritis, AAG for short, is a chronic inflammatory condition that affects the stomach lining, leading to gradual loss of gastric glandular cells. This condition is classified as an autoimmune disorder, meaning the immune system mistakenly attacks the body's own tissues, in this case, the stomach lining, the stomach mucosa. Over time, this autoimmune response results in atrophy or atrophic thinning of the stomach lining and a decrease in stomach acid production, which can have wide-ranging health implications. AAG is primarily caused by immune system targeting of the parietal cells, which are cells responsible for producing stomach acid, and a protein called intrinsic factor, which is a transport protein necessary for vitamin B12 absorption through the stomach lining. The destruction of these cells leads to a hypochlorhydria, low stomach acid, and vitamin B12 deficiency, because B12 cannot be absorbed because the cells in the stomach lining are damaged. This results in a type of anemia which is called pernicious anemia, a specific anemia associated with B12 deficiency. The exact cause of this autoimmune reaction is unclear, although there are genetic predispositions. For example, in this particular family that I'm talking about, strange that the daughter had the B12 deficiency, although she did not have the autoimmunity. We couldn't find any antibodies to parietal cells in her case. But who knows, maybe with time these might develop. You can believe I'm watching her like a hawk. So, as As we've already alluded to, the symptoms of B12 deficiency include gastrointestinal symptoms, problems with digestion, nausea, bloating, indigestion, neurological symptoms like tingling sensations, especially in the fingers and toes, difficulty walking, muscle weakness, and cognitive impairment. And hematological symptoms due to pernicious anemia, which is often characterized by fatigue and paleness of skin. Dizziness, shortness of breath may also occur. One thing that needs to be brought to your attention, people with chronic inflammation and atrophy of the stomach lining, basically patients with AAG, do have a slightly increased risk of stomach cancer than the general population, I meant to say, sorry. So it's important, if this condition is found, that regular endoscopies are done at certain intervals suggested, proposed by the gastroenterologist. This is important, that this cancer risk is managed and that it is not missed should it happen. Because the patient is under surveillance, if they do develop stomach cancer, at least we would have caught it at an early stage and not when it is end stage, when it is at a late stage, and then it's too late to treat it actively. And the only option left will be palliative. That would be obviously regrettable and tragic for the patient. So, how do we treat vitamin B12 deficiency? Well, the mainstay of treatment, as you would have guessed, is intensive injections of vitamin B12. It's one of those things that the more severe the deficiency, the less likely the patient is to be able to absorb B12 through the stomach lining, so it's completely useless to give them B12 supplements by mouth. It usually has to be injected. Dietary adjustments need to be made. Basically, things like alcohol and spicy foods should be avoided because they act as irritants to the stomach lining. The stomach lining already having been damaged by the autoimmune disease. And as I alluded to earlier, regular monitoring with endoscopic evaluations are also a mainstay of the treatment and follow-up of this particular condition. Our patient did have antibodies to intrinsic factor and parietal cells in his stomach, even though his daughter didn't. We were able to show that his nerves were severely damaged in his hands and feet by him having an electroneurogram done by the neurologists, and a quick trip to the gastroenterologists for a gastroscopy also revealed damage to his stomach lining. We had to intensively and aggressively administer vitamin B12 to him, obviously not by mouth. And over the last few months, he has regained his energy levels. His finger and toe numbness is slowly going away, and he feels alive again. He's able to enjoy life, go on trips with his wife and family, and the striking thing about this is he really thought his life was over. He thought he would have to retire into basically his bedroom or living room because his life was basically over. He was so tired. He thought that was part of normal aging. And of course it's not. We are very quick to accept poor health. What we should do is question the lack of energy, the symptoms that build up slowly over time. There is very often a solution. So I'm very happy for this gentleman that he was able to get out of the rut that he was facing. And now that he's retired, he can enjoy his retirement. The moral of the story is Don't suffer in silence. A simple symptom like tiredness or fatigue may not be just something you can put down to a busy life or old age. It could be something that is very much remedial, something very much correctable, like vitamin B12 deficiency. Don't be shy to get it checked out. Sometimes a simple blood test can literally change your life. Go for your checkup. And if you are in doubt about something, don't be shy. The comment section below is there for exactly that reason. By the way, don't forget to subscribe for further contents like this that gives you tips on how to maintain a healthy lifestyle, how to live a full, fulfilled, normal and healthy life. Subscribe, smash the notification bell, which will alert you when I post similar content online. But most importantly of all, go on. Put your questions out there for me to answer. Go on. Ask a doc.